This segment of DelmarvaLife is sponsored by TidalHealth.
It feels like everywhere you turn right now, someone is coughing, sneezing, or saying, hey, this flu is no joke. From schools and offices to grocery stores and waiting rooms, respiratory illnesses are spreading fast.
And for many people, this season feels tougher than usual. So what's really going on? What's happening? Who's most at risk? How can we protect ourselves and our community? Well, we're going to break it all down with Dr. Trudy Hall, Senior Vice President of Medical Affairs at TidalHealth. Welcome to Studio D.
Welcome.
Yeah, thank you. Thank you.
Let's start there. Why does it seem like this year is worse than usual?
Well, we have the data, and for some reason it started earlier. So it literally started right after Thanksgiving, which usually we see it start to peak really more around December, January. So it started earlier, and it actually rose so quickly to the point that Maryland, New Year's Eve, pretty much gave a warning that we were at high transmission levels because of the hospitalization rates. So, yeah.
Boy. Yeah. All right, so let's talk about the common symptoms you're seeing with this flu.
Well, the symptoms have been the same every flu season, and it's really all respiratory viruses that we're really concerned about. So, the usual cough, sneeze, runny nose, fever, general not feeling good, feeling tired. Sometimes you can even have stomach symptoms. So you could feel nausea. You can actually have diarrhea. So it could be one of the what we call influenza or flus, right? We also have what's called respiratory syncytial virus, RSV, which is commonly what we see like in young children and also older adults. And then COVID is still around.
Yes,
I mean, not as much. I mean, the numbers has decreased significantly, but we're still seeing COVID in the hospital.
So just about everybody's experienced the flu in their lifetime, but at what point do you seek medical attention?
Right, and I think it's really important because our emergency rooms for TidalHealth and Nanaco, now Berlin and right here in Salisbury, we have seen significant increase in emergency room visits to the point where we're literally having so many patients that we can't even get up to a bed or are in the waiting room coughing and sneezing. So a lot of times the simple symptoms, we really would rather you to go see your medical doctor, right? Or you can go to immediate care, right? We still have your Doxin and other immediate care centers for you to see probably when you have a light fever or if you're, having some sneezing and you're not really sure if it's the flu or COVID and you want to have some ideas. But it gets serious once you really get significant shortness of breath, if you start to have chest pressure, if you're not able to keep food or fluids down. And sometimes you can actually be lethargic, or you can actually have a loved one say, you look pale, or you're starting to look ashen. So it may be that your respiratory symptoms are really that significant that you really need to seek immediate medical attention.
Yeah. So what prevention steps beyond masking and vaccinations can we take to stop the spread of the flu?
Yeah, and I do want to say we just got the numbers out from Maryland. Only 36% of children from the ages of 6 months to 17 are vaccinated. And for adults, it's all the way down to 39%.
Oh, no.
So our numbers, I think it's just coming out of the COVID season. And really, I mean, there was vaccine fatigue. I mean, we know that, right?
Yes.
But vaccine still remains the most important way that we can actually decrease the severity of the symptoms and also the spread. And you can still get vaccinated right up until, as long as there's flu season and symptoms, you can still get vaccinated at any one of your local pharmacies. But the important thing is the spread, right? So, if you cough, cough within your shoulder, or don't cough within your hands. And I know you see this in the grocery store. You see people coughing and covering with their hands, and guess what? They take those hands and they touch a bottle or touch a shopping cart, or they touch your door handle. So literally, that's really, really common, the spread. And then people, when you start to have symptoms, stay home. Don't go to work. Don't go out in the community. Don't go to school, right? That's really, really important. And I think that's one of the things, I think as a community, we don't stay home and stay away from other people, and then we actually really spread the germ.
Trying to be a trooper.
Trying to be a trooper, but you know what? Stay in bed, put the covers over, put some Netflix on, and what I usually say is just be still, right? Just be still and allow me. Usually we say 24 hours after the fever is gone, then it's usually a little bit safer for you to go out and be around people. And then if you have someone who's in your household who may be sick, maybe wear a mask or sanitize a lot. Wash your hands. We really recommend the hand washing, sing happy birthday or hand sanitizer. That's still important. And also disinfect surfaces. That Lysol spray and wipes, it still works, right?
It still works.
So really disinfect surfaces and sometimes I call it quarantine. Sometimes you may need to quarantine a family member or friend until they're feeling better.
So speaking of masks, what was the reason for implementing the masks at the TidalHealth locations?
Right. So this happens every flu season. So this is nothing new or nothing different, right? So we usually wait for the guidance from the state to be able to say we're at a high level of transmission. And they really look and monitor the numbers of hospitalizations. So once they have pretty much, we call it 10 out of 100,000 that are being hospitalized, and we saw a rapid rise of hospitalizations right after Christmas going into New Year's. And that's that notice that we got the day before New Year's Eve from the state of Maryland Department of Health to say, okay, people, we're at a high level of hospitalization. We are now recommending masking in the hospital level. So we have what we call our own policies, and we have what we call the lowest level of masking, which is really patient facing. So it's if you're coming to visit and you're going to see a loved one, they could have the flu, you're going into the room, we want you to sanitize your hands, we want you to wear a mask. And then for our staff, because I can't stress the importance, we have to keep our staff healthy, because if we don't have our nurses and doctors and techs and all the other staff healthy and to protect them, they will not be able to not only treat the flu, but any other medical condition. We won't have the staff to really treat the community, and that's really, really important.
It's a real small step to keep everyone safe.
Everyone's safe. Safety comes first and quality comes first.
Thank you so much, Dr. Trudy Hall with TidalHealth, and let's all stay healthy.
Yes, thank you so much. My
Thank
pleasure
you.
on being on today.